NC State students start classes Monday. In the new school year, it is a fresh start for a campus that was devastated by loss. Last year, 14 students died on campus, 7 of them from suicide. The school was announcing new mental health resources for this year, and that includes a peer support platform called Together All, adding more counselors to the university's counseling center and individual schools, as well as the university also creating a student mental health task force to dive deeper into mental health issues that students are experiencing on campus. Heading back to school, it can be stressful for kids of all ages, especially if they found the previous school year to be challenging. Dania Backus has details on resources to help parents address those concerns before they turn into bigger problems.
Fifth grader Sophia Schmidt has been dealing with anxiety since she was in kindergarten. Her mother, Megan, says it started affecting her behavior.
Retreating from activities that she's always loved to do, wanting to stay closer to myself and my husband.
They say therapy helped address it, but once the pandemic hit, Sophia's fears of getting sick made it difficult for her to return to school. Even now, she feels anxious starting a new school year.
What are some of the things that kind of worry you or make you a little nervous about going back to school?
Meeting new people and also if my teacher's nice.
According to a new survey, 71% of parents say something made the previous school year challenging for their child.
Parents identified safety concerns, academics, bullying, and mental health concerns, as well as social connection, as the top concerns that they saw their kids struggling with.
Dr. Whitney Ragland Bignall is a pediatric psychologist and associate clinical director for On Our Sleeves, a movement for children's mental health.
We have to start having conversations and start to see what they're thinking and feeling, how they thought last year went.
To help facilitate those discussions, On Your Sleeves has created resources for parents, which include conversation starters. Megan and Sophia say they've helped.
I don't always know the right questions to get to the root. Some suitable questions to ask to try to get there has been very, very helpful.
It helps a lot because I feel like I can get it off my mind and help me not worry.
And feel less stress with the anticipation of the new school year.
Well, with more kids and teens being diagnosed with anxiety, research shows medication could be substituting therapy, a choice that experts say they don't recommend that you make. Kids with anxiety are having a tough time getting the care that they need, so let's connect the dots. The CDC says more than 5.5 million children in the U.S. have a diagnosed anxiety disorder. But as the number of kids who get on anxiety medication rises, the number of children receiving therapy has dropped. Psychologists say therapy plays an important role. Experts say the lessons learned can help kids overcome their anxiety. But that's not an easy fix either. Researchers say there aren't enough pediatric therapists to care for all the patients out there, making it difficult for kids to get the complete care that they really need. And that is connecting the dots. As your students prepare to go back to school or moving back into their dorms, experts say it is important to have those conversations with your kids about mental health.
Actually, 1 in 4 adults experience a mental illness within a given year here in the United States. And as it pertains to suicide, it's a lot more common than folks may think as well. In the United States, I believe that there is around between 120 to around 130 odd suicides a day.
There's a lot of publicity around suicides and things like that when it happens. Talk to them about how they feel about that. If they had friends who have had those feelings, if they ever had those feelings, and keep the communication open.
Both mental health experts say there are signs that parents can look out for even from afar. That includes having some academic struggles, pulling back socially, not taking care of themselves physically, a change in the eating or sleeping habits, changes in mood or energy.
The smallest of details can be the most significant thing that can save someone. So everyone, please pay attention to yourselves, pay attention to the ones that you love, and the ones that you are aware of, because that is the one thing that can make a difference.
You can sometimes assess just through phone calls. If they are closer, they're not across country at a college, but they are down the road at NC State, UNC, or App State, someplace drivable, periodic visits, especially if they describe to you they're having some difficulties.
And if you believe that your child is struggling, you can help them by doing research about different mental health care options in their area. You can collaborate with them to get them care, and at the end of the day, remind them that there are resources available to them 24/7. If you or anyone you know is struggling with an addiction or a different mental health crisis, call 988. That is the number to the National Suicide and Crisis Lifeline. You can call or text 24 hours a day, 7 days a week.